This video demonstrates the use of a sinus elevation practice model to illustrate the drilling protocol of a lateral window sinus elevation with Caldwell-Luc lateral sinus elevation drills. A lateral window sinus elevation is a surgical procedure used to increase the vertical height of bone in the posterior maxilla. It is the recommended method when there is less than 5 millimeters of bone for dental implants with a large maxillary sinus. It is used to elevate and preserve the integrity of the sinus membrane and to provide an adequate bone graft to support a 10 millimeter implant. This procedure is done with or without repair or replacement of the sinus membrane if it has been damaged with a lateral window. The procedure involves a carefully planned sequence of drills, the Caldwell-Luc lateral sinus elevation drill set with reverse threads designed to safely elevate the sinus membrane. Each drill is used with irrigation, which serves to reduce heat generation and assist in moving bone particles forward, protecting the membrane. The drills vary in size, with increasing diameters between 1.5 millimeters and 6 millimeters. Each drill features a tapered design, which moves bone particles forward when rotated clockwise at rotation speed between 800 and 1,000 revolutions per minute. This systematic approach continues until grafting material is inserted into the prepared site, uplifting the sinus membrane. The lateral sinus elevation drill's design is based on a reserve escape angle. When rotated clockwise, the flutes push bone particles forward, unlike a traditional step drill, which pulls the bone particles outward when rotated clockwise. The blunt tip of the drill pushes the sinus membrane out of the way, and the bone particles are pushed forward. Initial drilling sequence and membrane response for the lateral window sinus elevation protocol is demonstrated in this video using sinus elevation practice models, available on deplaque.com. The following instructions are for use with 3 and 4 millimeters crestal bone sinus chamber thickness. The lateral window approach is often recommended for a sinus elevation with less than 5 to 6 millimeters of crestal bone. Simultaneous implant placement may or may not be recommended in this situation. The implant must be stable when placed, or it will not integrate. Step 1. Start with the first drill gold 1.5 to 2.2 millimeters outside diameter by 2.2 millimeters long. Remove the particles from the buccal wall of the artificial plastic sinus model with clockwise rotation. This action may result in a slight elevation of the sinus membrane depending on the thickness of the wall of the sinus and if the wall is perforated. Step 2. After the first drill, before continuing to subsequent steps, a 2 millimeter probe is gently used to check for bone penetration to palpate the soft membrane, which may or may not confirm penetration of the bone. Step 3. Continue with the second longer gold drill, 1.5 to 2.2 outside diameter by 3.5 millimeters long. Removing the particles from the buccal wall of the artificial plastic sinus material, pushing them forward with clockwise rotation, may result in a slight elevation or further displacement of the sinus membrane, indicating the thickness of the wall of the sinus is less than 3.5 millimeters. After the second drill is used, and before continuing to subsequent steps, reprobe again gently with the 2 millimeter probe to check for bone penetration and to palpate the soft membrane, which may or may not confirm penetration of the bone. Decision points based on probing. Following the use of the second gold drill 1.5 to 2.2 by 3.5 millimeters long, if probing still reveals no opening or elevation of the sinus membrane, proceed directly to the third rose drill that is 2.0 to 2.9 by 3.5 millimeters long. If probing indicates the second gold drill produced the opening of the bone surface, skip the third drill. Proceed to the fourth drill, which is the rose 2.0 to 2.9 by 4.2 millimeters long. Reprobe after third and fourth drills. Again, the 2 millimeters probe is gently used to check for bone penetration and to palpate the soft membrane, which may or may not confirm penetration of the bone before continuing to subsequent steps. Step 4. Further elevation of the sinus membrane occurs as the diameter of the osteotomy and the length of the opening increases with the fourth rose drill 2.0 to 2.9 by 4.2 millimeters long, resulting in additional elevation of the sinus membrane. Steps 5 and 6. Use the fifth blue drill 2.7 to 3.7 by 5.2 millimeters long and the sixth black drill 3.7 to 4.7 by 5.2 millimeters long to further expand the diameter and the depth of the osteotomy, simultaneously pushing bone fragments removed from the wall forward, resulting in further elevation of the sinus membrane. Probe gently with 2 millimeters probe to check for bone penetration of the bone before continuing to subsequent step. Step 7. If the bone has not been penetrated after the 6th black drill, use the 7th longer silver drill, 4.7 by 6.2 millimeters long, further increasing the depth of the osteotomy. Step 8. The final 8th gold drill, 3.5 to 5.5 by 8 millimeters long, features 4 flutes and a blunt tip to move it horizontally and vertically to enlarge the osteotomy, while pushing the membrane aside with a blunt tip. Use it to increase the size of the opening to fill with graft material or replace the membrane. Step 9. Once the drilling sequence is complete, sinus membrane elevators are used to free the membrane and place collagen graft material, with or without BMP2. This step results in the lift of the sinus membrane from the floor and the walls of the sinus. Consider CT imaging in the next steps. Step 10. A CT scan was done to evaluate an implant site 3 months after a failing implant was removed and grafted with osteogen and BMP2. Step 11. Elevate the sinus membrane and apply osteogen collagen with 100 micrograms of BMP2 infused to support grafting and bone regeneration. A surgical approach, flap design and reflection. A full-thickness flap was raised via a crestal incision along the alveolar ridge to access the surgical area. In this image, the arrow indicates the previous implant removal site that occurred 3 to 4 months prior and was grafted with osteogen and 50 micrograms BMP2. Surgical technique, osteotomy preparation and membrane placement. An oval osteotomy was made using the drill set to progressively prepare the site for grafting and sinus access. The membrane was torn and was replaced with a collagen membrane. A BioHorizons 20 by 20 millimeter collagen membrane was moistened and rolled for placement inside the sinus, then unrolled below the membrane. Care was taken to maintain control of the outer end of the membrane to avoid losing it in the sinus cavity. Here is an X-ray of a planned 4.8 by 12 millimeter Strawman implant, which was placed and stable at the time of the elevation. Note the 3 cross-sectional images of 2 10 by 20 millimeter osteogen plugs and 100 micrograms of BMP2 placed below the collagen membrane after the initial opening, during the sinus elevation and following the sinus elevation. This is CT images 6 weeks after surgery, demonstrating the advancement of mineralization. What about membrane replacement? This is an internal view of a sinus membrane practice model illustrating the increasing elevation of the sinus membrane before the addition of the graft material. Let's consider a compromised sinus membrane. If the membrane is compromised, ensure that the opening of the sinus wall is large enough to accommodate the placement of a new collagen membrane. Remove or elevate any remaining remnants of the membrane from the palatal wall of the sinus cavity. Use the 2 millimeter probe to measure the buccolingual width of the sinus cavity. Sinus membrane elevators are available or may be included in the drill set, are used to separate the Schneiderian membrane from the sinus wall. If the membrane can be lifted without causing damage to it, the grafting material should be positioned beneath it, ensuring contact with the sinus floor, as well as the buccal and palatal walls. The available sinus membrane elevators include a 90-degree curved elevator, used to separate and lift the membrane from the buccal wall and the floor of the sinus cavity. A short 45-degree curved elevator, used to separate the membrane from the palatal wall of the sinus cavity after it is elevated from the buccal wall and the floor of the sinus cavity. And a 180-degree U-shaped elevator, used to replace the compromised membrane with a new collagen membrane. Protocol for sizing the membrane. The buccal palatal width of the sinus chamber should be measured. The membrane's length should be at least double the width of the chamber and equal to or greater than the width of the opening. A cone beam can be used to measure the sinus chamber width. The collagen membrane is placed over the opening of the sinus chamber approximately the same width as the opening, or wider. The 180-degree U-shaped elevator is used to press the membrane into the sinus chamber. When positioning the membrane, ensure the upper and lower edges extend beyond the membrane cavity especially the upper edge outside the sinus cavity. Then, place the graft material inside the membrane. Replacing the membrane is significantly simpler when the opening is larger. This opening measures about 12 by 12 by 12 millimeters. Memlock resorbable collagen membrane is available from BioHorizons. An illustration on how to cut and position a simulated collagen membrane in the practice sinus model. Cut a 30 by 40 millimeter L-shaped membrane and position one leg on the top and the other on the side of the protruding opening of the sinus model as illustrated. Excess material can be trimmed after placing the graft. After elevating the sinus membrane from the sinus floor and medial wall, place the V-shaped membrane with its two legs protruding. Place the graft material into the opening, ensuring the ends of the two legs extend outside of the opening. Recommended grafting materials. Start with collagen-rich materials to lift the membrane. Purus by ZimV, Osteogen by Implant, Mineraz by Medtronic. Grafting materials used with BMP2 are shown in various magnifications. A low magnification of SEM of osteogen, where calcium apatite can be observed between the collagen fibers. A higher magnification SEM of osteogen illustrating the collagen fibers necessary to bind the infuse BMP2, and the highest magnification SEM of osteogen illustrating the 67 nanometers cross-banding of the collagen fibers. A collagen membrane should be available for repair if the sinus membrane is damaged during the process of elevation. Illustrated here, you can see the sequence showing 2 or 3 10 by 20 millimeter osteogen plugs. Then cut osteogen plugs in quarters lengthwise, and finally 100 micrograms of BMP2 in 0.4 milliliters sterile water or saline applied for 15 minutes prior to placement in the sinus chamber.